Hello and welcome. We're about to dig into the huge shifts happening right now in the business of healthcare. If you're in this industry, you already feel things changing, right? But today, we're going to break down exactly what those changes are and, more importantly, what they mean for your bottom line. All right, let's get into it. So, that's the core message from our source material, and they're not mincing words. This isn't just a small adjustment. We're talking about a fundamental, tectonic-level transformation. And what's driving it? It's really two things: powerful new technology and this growing demand from patients for care that's just better, more accessible, more efficient, and way more personal. It's a great question, isn't it? Seismic shift sounds big and a little scary. For business leaders, for administrators, it really just means that the old ways of things, well, they're not going to cut it anymore. The real question you have to ask is, how do we adapt? How do we not just survive this, but actually come out on top? To answer that, we're going to zero in on 4 key transformations. You can think of these as the main engines driving that massive shift we just mentioned. If you can get your head around these 4 things, you're on your way to building a solid strategy for the future. So here they are. First up, you've got AI and machine learning, and they're completely rewriting the rules for both clinical work and back-office tasks. Second, the absolute explosion of virtual and remote care, which is making healthcare available in ways we never thought possible. Third, and this one's a biggie, the critical need for top-tier cybersecurity. And finally, we're seeing this massive change in how people pay for care, moving towards something called value-based care. Let's break each of these down. So the thing about AI is that it's not science fiction anymore. It's here, and it's being used right now. On the clinical side, yeah, it's helping doctors spot diseases earlier. But from a business perspective, it's an absolute powerhouse for automating all those repetitive, administrative jobs, like billing and coding, that eat up time and can lead to costly mistakes. Next, let's talk about virtual care. And listen, this is so much more than just a video call with your doctor. It's a whole ecosystem. You've got telehealth for basic checkups, sure, but then you have remote patient monitoring, which lets you manage chronic conditions like diabetes from home. And then there's this concept of a digital front door, basically a single app where a patient can do everything: schedule appointments, check results, pay bills. It's all about making the patient's life easier. Now, with all this data flying around, there's a huge risk. Healthcare is the #1 target for cyber attacks, and a data breach can be devastating, not just financially, but to your reputation. That's why cybersecurity isn't just an IT problem anymore. It's a C-suite, board-level business priority. If patients don't trust you with their data, you're done. And this slide really nails the final shift. For decades, the model was fee-for-service. You do a test, you get paid. You do a procedure, you get paid. It was all about volume. The new model, value-based care, completely flips that on its head. It rewards providers for quality, for good outcomes, for actually keeping patients healthy in the first place. This is a game changer. Okay, so let's zoom in on that first transformation. We're going to go a little deeper on AI now. Let's look past the buzzwords and see how it's actually working as a business engine, something that directly affects your costs, your efficiency, and even how happy your staff is. What's so cool here is how practical these AI tools are. Look at this. For admin work, you use a chatbot and suddenly your staff has more time. For your revenue cycle, you automate the billing, which means fewer errors and faster payments. You can even use AI to predict staffing needs so you don't have too many or too few people on shift. Each one of these solves a real, tangible business problem.
And really, this is what it all boils down to. This is the goal. It's all about automation. You take those repetitive, mind-numbing tasks off your staff's plate so they can focus on what they were actually trained to do: take care of patients. This is a huge strategy for tackling the burnout crisis we're seeing across the industry.
All right, let's do another deep dive. We've hit AI. Now let's circle back to virtual care. We're going to walk through a really practical guide for setting up a remote patient monitoring program. It can seem like a huge, complicated project, but the source material lays it out in a super clear step-by-step way. See? The key is to just break it down into these 3 phases. You start with planning, then you move to the tech and workflow piece, and you finish up with deployment and evaluation. When you look at it like this, it feels so much more manageable. So in phase 1, it is all about being crystal clear. You need specific, measurable goals. Don't just say, we want to improve patient health. Nope. Say, we're going to reduce hospital readmissions for our heart failure patients by 15%. You also want to start small with a specific pilot group, and this is critical. You have to get everyone on board, from the executives down to the frontline nurses. Okay, phase 2 is where you get into the nuts and bolts. Picking the right technology is obviously a big deal. It has to be easy to use for both your patients and your staff. But just as important is mapping out the human side of it. You need to have standard operating procedures. What happens when a patient's blood pressure reading is too high? Who gets that alert? What do they do? You need a clear plan for everything. And finally, you deploy. This phase is all about training and tracking. You train your staff on how to use the software, but also on the right billing code so you actually get paid for your work. You teach your patients how to use the devices and why it's so important. Then you launch your pilot, and you watch your data like a hawk, measuring it against those goals you set way back in phase 1. So we've looked at these massive transformations, we've gone deep on AI and remote care. Let's pull it all together now. What's the one big thing, the ultimate takeaway for anyone leading a healthcare business today?
I think this quote from the source material just says it perfectly. The winning strategy isn't about buying one cool piece of tech. It's about weaving all of these tools, AI, virtual care, data analytics, into a single cohesive system. And what's the guiding star for that whole system? The patient. Everything has to put the patient right at the center.
Ultimately, every single trend we talked about today points in this one direction. It's about using technology to deliver care that is more personal, more convenient, and more data-driven, all revolving around the individual. And that leaves us with one final thought for you to take away. The future is already here, and it's all about the patient. The only question left is, are you ready for it?